Good morning. I'm Gordon Smith, the state's director of opioid response. Happy New Year and thanks for giving us an hour of your time today to learn about our plans for 2022 and to take a look back on 2021. I hope you're all enjoying a little snow today and staying safe. I think this is a really important program today because it, as we transition from one year to the next, gives us a nice opportunity to see what we accomplished in 2021, review any areas of disappointment and challenges, and to talk about where we want to put our resources in 2022. I hope you'll all feel comfortable. There's nearly 500 of you that signed up for today's program, so I hope you'll all feel comfortable with sharing with us after the program. Send us an email with your thoughts on what we share with you and your ideas. We want this to be participatory, but it's not possible in this hour with 500 people to have you talk with us directly. Please put any questions, though, that you have in the question and answer room, not the chat room, but the Q&A room, and we will answer every question. Those that we don't get to today, at the end of the 3 presentations, we will put on the AdCare website, and you can and every question will be answered. In other housekeeping work, your evaluations will be sent out after the program. You'll all get a certificate of attendance. Those of you getting CME, when you return your evaluation form, you'll get your CME certificate. Our next monthly webinar will be February 4th. Same time, first Friday of February. We don't have a topic yet, but we are considering in some of our monthly programs asking some of our national partners from ONDCP or SAMHSA or the DEA. We may get some national presenter between now and the Governor's Summit, which is still scheduled for Monday, July 11th in Bangor. I'm delighted today to be joined by Dr. Marcella Sorg from the Margaret Chase Smith Policy Center at the University of Maine, and by Bruce Noddin, the founder and executive director of the Maine Prisoner Re-entry Network. These 2 individuals are enormously important to our opioid response work in the state. Dr. Sorg has been at the university for a number of years. She has a PhD and is a forensic anthropologist. She is a native of Ohio and did much of her education in that state and did a graduate work at Ohio State. She's been the primary person working with the Office of Chief Medical Examiner to do the overdose reports for Maine for many years. And she's assembled a tremendous team at the Margaret Chase Smith School which is also assisting us with our overdose review panel, which met for the 4th time just this morning for 3 hours. Bruce is equally important to us. He is a native of Maine, grew up in Auburn, was a business owner, and 5 years ago founded the Maine Prisoner Re-entry Network, having been incarcerated himself and now being a person in long-term recovery. His organization is doing incredibly effective work, helping people re-enter to the community from incarceration. And so being a person with lived experience, we try to have that voice in all of our programming. And so following my presentation, then Dr. Sorg will give the data that supports what I'm going to be telling you and sharing with you. And then we've asked Bruce to comment on our plans, as well as to comment on the plans for his organization over the next year. The network, the Prisoner Re-entry Network, is a statewide organization made up of hundreds of other organizations and individuals dedicated to supporting people who are releasing from prison and jail and it was created 5 years ago to measurably reduce the rate of recidivism in the state of Maine through relationships, connections, and community collaboration across all sectors. They put together a very collaborative call every Tuesday morning, 9:30 to 11, as I recall, that just draws together a lot of people that are so compassionate about this work. So again, I couldn't have two better partners this morning. But with that, I'm going to share my screen, and I believe that my slides will come up here in a moment. I'm going to assume that people can see those.
Yes, we can.
Okay. There must be something I'm okay. I got to get rid of that maybe. My slides aren't advancing for some reason. I wonder why that is.
See if you click on the screen, Gordon, what will happen? Just physically click on the screen.
Is that all I need to do? Yep. This is why we have project managers. Thank you, Josh.
You're welcome.
Fairly simple technique. I'm going to review very briefly because we have three presentations today, and we'll be challenged to get it all in the time allotted. So I'm going to go through our plan very, very briefly. Most of you are aware that our 4 focus areas plus leadership have not diverted since we began this work in February of 2019. We do prevention, treatment, harm reduction, and recovery support. Within that, we have 10 priorities. Across those focus areas, we have 33 different strategies and literally hundreds of different activities. If any of you, that is now on our maindrugdata.org website. If you go under reports and things, you'll find our strategic plan. It's not 100 pages, it's about 12 pages. And again, I need to get rid of this little thing over here so that I'm able to see my entire screen. How do I get rid of my little panel that I'm seeing on the right-hand side? Getting no advice.
Is there a full screen button anywhere? If you go to full screen, you shouldn't see the panel on the side. In the corner, is there something that says view maybe?
I'm not seeing that option, but maybe if I go right there, choose one.
You can click on the panel at the top, Gordon, of it, and then drag it to the bottom or to the other side of the screen.
Oh yeah, good, that worked. Thank you. So the ultimate goal is to reduce the negative health and economic impacts of opioid and other substance use disorders on individuals, families, communities, and in doing so, give hope to all persons with a substance use disorder that recovery is not just possible, but probable. And again, our shared values over all of the 4 focus areas deal with stigma, resilience, data. We want our decisions to be informed by data. None of it's possible without an infrastructure of people and organizations and resources to support the activities. And again, to use all the resources available, whether from the federal government, the state government, community, and philanthropic resources. I left this slide in from my previous presentation because I wanted to remind us that the work's never been more important. We're doing important things. We're making progress in some areas, but it's still an exceptionally dangerous time out there, and all of you are aware of that. We've got way too many youth experimenting with experiencing traumatic events and experimenting with substances. Treatment. We talk about, the absolute need to have treatment available immediately when people are ready for recovery and have it local. and affordable, and that we are not where we need to be on that. And we'll talk about that today. Many people still in recovery still face stigma in all segments of our work. And there's challenges like transportation, housing, employment, and many of these shortages and challenges have been exacerbated by the pandemic. The pandemic's made the recovery from SUD, much more difficult, and that's certainly one of the causes behind the spike in overdoses and in the mortality of overdoses. Over the last decade, about 11 years actually, in Maine, we've lost 4,000 people, which is just an extraordinary number and clearly unacceptable. So these monthly webinars and our annual summit are one of the most visible signs of the governor's leadership and the work that we do every day to implement our strategic plan. But I want to particularly focus on that third bullet point, because the really exciting work being done, and I think the most effective work being done, is being done in the communities. The number of community partners and coalitions we have, Bruce is going to be talking about this during his presentation, is just extraordinary. The recovery community in Maine is extraordinary. And the number of people who identify as being in long-term recovery and are giving back by being a recovery coach or otherwise assisting people at a recovery center or at a recovery residence, it truly is a beautiful thing. So while I greatly appreciate the governor's leadership, it really takes the proverbial village to move this very, very complicated issue in a more positive direction. So what did we do in taking a look back on 2021? What have we accomplished? Well, since we started the Maine naloxone distribution initiative and the 4 tier 1 distributors, which I really so appreciate their work, Portland Public Health, Bangor Public Health, Maine General, and Maine Access Points. We've distributed now 132,422 doses of naloxone, and that largely is what's responsible for 3,195 reversals. That's just what was voluntarily reported from our supply, and there's an estimated 10,000 individuals nearly who survived an accidental overdose, with most of those survivals being attended by EMS or the police departments. We've brought in, and this is in a 12-month period, 237 more recovery coaches have been trained. It's remarkable that when the governor and I started this work, that there was virtually no medication-assisted treatment or medication for opioid use disorder in the incarcerated populations. And since that initiative began with some financial support from the state, now just in the Department of Corrections alone, not counting the jails, there's over 1,000 residents, inmates of the Department of Corrections that have now been treated with medication despite the challenges of COVID. So I just can't give Deputy Commissioner Thornell and Commissioner Liberty enough credit for what they've been able to accomplish in that realm. And the jails, I think they're trying. We have great partnerships with the sheriffs and the jail administrators. We support a lot of that activity through the Office of Behavioral Health. And this is kind of an estimate because we're just now getting quarterly reports on how many residents of the jail are treated medically. But we can pretty much document that at least in 2021, that at least 350 individuals have been. We continue to grow those programs, and we are appreciative of the work that the sheriffs and the jails are doing at a difficult time, COVID-wise. Maine Care, our partners in Maine Care, they increased rates for medically supervised withdrawal, formerly called detox by 77%. We also substantially increased the rates, tens of millions of dollars in increased rates for providers providing substance use disorder treatment. It's still not the same as, there's still a gap with with private pay and with commercial insurance, probably always will be, but they are trying. And I always, in terms of accomplishments of the administration, Executive Order 1 expanding Medicaid to the point where now today 89,000 individuals are just in that expansion population, and over the previous 3 years 120,000 people have been covered, and with hundreds, I don't want to give the figures, I don't have it right in front of me, how many thousand people in that expansion population are filing claims for either mental health services or substance use disorder treatment, but it's a lot. Goodness gracious. I'm not advancing again because I've got some kind of screen at the top that's affecting me.
You hit your space bar or your arrow button, does it advance?
It's not advancing right now. I can, I think it has something to do with a thing I've got up at the top that should have been at the bottom, it seems to me, Bob. Let me see. No, I just can't. Have you got them up, Lorena, so that you could advance them? How long would that take you to do? While I'm talking about the, while I'm going through this next slide. Okay, good. Looks like Lorraine is able to do that. I want to go to that next slide. Great, thanks. So you're sharing your screen, Lorena? I'm going to assume yes. So proceeding along with the accomplishments, we have been able to advance some forms of treatment. There were 2 new OTPs, opioid treatment programs, otherwise known as methadone clinics, opened in Maine. One in Presque Isle, one in Saco, late in 2021. Those were the first new methadone clinics in Maine in well over a decade. We keep adding recovery residences. There's 11 new certified this year through the Maine Association of Recovery Residences, and we appreciate their efforts. We've added 6 new syringe service provider sites with the annual report's about to be released that shows that 2.7 million clean needles syringes were dispensed, a big increase over the previous year. We've added 1 new recovery center in Ellsworth, but we have 3 on the drawing board that we have some state support anticipated for in Augusta, Rockland, and Sanford, at which time we will have 21 recovery community centers, and we can base a lot of positive activities in those communities. And then I don't want to forget primary prevention and the work that's being done in the schools. And we got 9,400 registered users of the social emotional learning curriculum that the Department of Education has made available, 430 modules available K through 12, free of charge to every school in the state of Maine. Next slide. Some of the challenges that we've had moving from accomplishments to challenges. Obviously, the great disappointment has been that there's been a continued increase in the number of fatal overdoses, and certainly in the number of overdoses overall. We do want to acknowledge that for every fatality, there's about 15 people who survive their overdose, usually through Narcan, and we're very proud of that. But we don't want to minimize at all the fact that we'll have about 630 fatalities reported for 2021, which is a 23% increase from the previous year. People were very concerned last year in 2020 when we had 515 overdoses. That's a little different than the number you've seen before, because these are really suspected until they're confirmed by the national lab that's used, and the lab is understaffed and delayed, and so that it takes a number of months for these toxicology tests to come back. So we're relying mostly upon suspected data, suspected overdoses, but that the suspected to confirm doesn't change all that much. But again, I mean, this was a very big challenge in 2021, needless to say. What are we doing about it? Well, we continue to increase naloxone. We put the liaison program on the ground through the efforts of the Office of Behavioral Health, somebody in each county to reach out to people who have survived their overdose and try to link them, connect them with more harm reduction or a road to recovery. And now we've got the new overdose review panel that does a deep dive into individual cases to see what the gaps are and how that could affect policy. And then we have our 3 new websites: the MaineDrugData.org website operated by the university, the Get Maine Naloxone also operated by the university, and the Know Your Options.me, which is operated by the Office of Behavioral Health. I encourage you to check out all those websites and appreciate what we've been able to do with those. Next slide. Other challenges, the continuing impact of COVID, the healthcare workforce challenges, enormously difficult as we try to put more efforts into treatment, residential care, and detox, for instance. We can put up buildings, but if there's nobody working them to provide that quality healthcare, it doesn't matter how many buildings we have. So you all struggle with that, all the treatment providers on this call, and we absolutely have to really focus a lot of attention on improving that healthcare workforce situation. The pandemic did affect our ability to really advance our low barrier access program in the emergency departments, because beginning in March of 2020, people stopped going to the emergency department. And then likewise, it was more difficult to get our recovery coaches in the jails. So the jails would be way further advanced in their MOUD programs had it not been for COVID. There's also, again, barriers to quickly standing up our new treatment options, just because it takes a long time to put these things together. I do have reasons for optimism for the coming year. We have more resources through the case settlements, through the expanded efforts of the American Rescue Plan, more block grants, more private philanthropy even. We have the prevention and treatment program. We have more resources available. It's just a matter of getting them out the door and getting the programs implemented. We have a very focused and engaged leadership. I think that goes without saying. And I think as we get through the winter and get COVID somewhat behind us, that we will see improvement in our efforts. Next slide. And I'll go quickly now because I want to get to this. I actually just got a couple of photos. This was our first summit in 2019 when we never heard of the coronavirus. We had about 1,200 people at the Augusta Civic Center, and Sam Canona's author Dreamland was our speaker. Next. This is just an example of our work that we were doing in terms of advancing our work through film and through the filming that we've done. This was the evening that we debuted Jacinka movie, the Jacinka movie that's now streaming on Hulu at the Shotwell Drive-In Theater, which is owned by our partners at down east. The next slide. What are our priorities? I want to go quickly here. In terms of investments, clearly more treatment, more medically supervised withdrawal, absolutely need more detox beds and more residential treatment, more waivered providers. We have 100 more than we had last year, but it's still not enough. We need more treatment of every kind. We need better transportation options for people, and we need more treatment in the county jails. We don't want to forget our harm reduction activities, so long as the overdoses continue to be high, and we're going to improve our messages around the dangers of fentanyl, fake pills, the new meth that's here that's not based upon ephedrine. All those things, all those public education things need to continue. Need to continue our distribution of naloxone and add to that fentanyl test strips, fully implement our overdose review panel that just got established this past year, and continued support for our 18 sites for our syringe service providers. When you think about where do we find people that are most at risk in this system, the people who are still injecting drugs, we find them obviously and can help them and reach out to them and give them information that can help keep them alive through our syringe exchanges, which had 5,400 individual clients last year. We want to grow the options program, support those individuals. This is really hard work. We understand that. And we want to have more liaisons and support them in every possible way. We need to do more anti-stigma education in all the fields, among law enforcement, among the public, among healthcare, and we plan to do that. We have some resources for more community recovery community centers. There's a piece of legislation that passed last year that directs us to give priority to those counties that have no state-supported recovery center, and we will do that. I believe that the 4 counties that right now have no community recovery center, York would be one, but they have one about to open if it's not already open. But Piscataquis, Somerset, Oxford have none. And so they will be prioritized in 2022. Again, we want to address the healthcare workforce challenges. I've talked about that. We want to continue the terrific data group that Rebecca Taylor has put together at the Office of Behavioral Health with the help of the university team. We have this opioid data sharing committee that brings in about 25 sources of opioid data, breaks down those silos, puts that data on the Maine Drug Data.org hub, and it's an impressive operation. We don't want to forget about primary prevention. Governor asks about it every time that I'm with her. What are we doing on prevention? Prevention. It's the only way long-term we're going to really make this situation dramatically better. And that really starts with our children. We want to continue to invest in treatment, and we also want to see continued improvement to the prescription monitoring program, which is about to hire some additional staff, and that will allow more analysis of any poor prescribing practices that could lead to people becoming addicted. And we do have the money now available through grants, and there'll be 2 new additional treatment and recovery courts in the Mid-Coast region and in Oxford and Franklin County, and we're very pleased about that. Next slide. I think actually now I just got a couple photos, and then I'll turn it over to Dr. Sorg. This was the governor at the first summit, or the second summit. The other picture is actually from Booth Bay when we were recognizing annual the annual Overdose Recognition Awareness Day, August 31st, and lighting candles for people that had been lost that year. Next. Portland Community Center, I'm sorry I don't have the picture of the new center on Bishop Street, but we certainly have a lovely picture of Leslie Clark, our executive director there, with the governor when the governor visited last week. The governor next week will be opening what's called Freedom Place, which is a home for women in 66 State Street, really operated by Amistad, and governor's going to be there with me Tuesday to open that property, which we're excited about. Next. You know, to spread it around the state a little, this is what's affectionately known as the farm up in Limestone, operated by AMHC. We need more. It's one of the last traditional 28-day programs along with Crossroads, and we need more people, more facilities like this. Next. This is one of our 18 community recovery centers. This happens to be the one peer-to-peer in Millinocket. Ginger and Michelle cutting the ribbon on the opening day, and they do a terrific job up there. I just include this photo as a representative of all the recovery centers. Next. There's the incredible Eric Lamoureux, the day that he showed me the Aroostook Recovery Center in Halton. We have recovery centers in Halton and in Caribou, as you know. And again, these are then, they don't provide treatment, but they're drop-in centers, do, you know, AA meetings, all kinds of meetings, feature a lot of activity, but most importantly, people in early stages of recovery and in long-term recovery can go in, and people who are still using can go in and know they won't be judged. They will find people that to be with, who will love them, support them in a compassionate way. Next. But fortunately for you, that's the last slide. And I'm going to turn it over to my friend, Dr. Sorg, who will give you some data that will hopefully support some of the things I've been saying.
Thank you, Gordon, and good morning, everyone. It's almost afternoon, maybe the clock has gone to the afternoon. Anyway, I am going to talk to you today about some of our data. We've been collecting data pretty heavily. I've been working on it since 2002, actually, but more recently, we've been able to get a lot of that data made public, as Gordon was referencing. I'm going to share my screen now. I've decided to focus on the overdoses. It's a difficult topic, and it's hard to understand how these things could still be happening when we have put so much effort into trying to abate them. I have entitled this talk "The Fentanyl and COVID Epidemics" because these two factors have really played a huge role in the problem. Oh, I'm having trouble advancing too. Just a minute. There we go. So what I'd like to do just briefly today is talk about what the overdose data are showing us, talk a little bit about why it's happening and what we're doing about it. Gordon already showed you the percentages of the increase from 2018 to 19, 7%, then 36%, and we expect 23%, although we won't really know about the rest of December until probably sometime in February. one of the most important things that people need to understand about those overdoses is that almost a huge percentage of them, 77% this year, are due to this drug fentanyl. And that proportion has actually been increasing. Last year, it was 67%. And we believe it's at least 77 now. Fentanyl is critical. I'm sure most of you have heard about it, but it is at least 25 times more potent than oxycodone and up to 100 times more potent than heroin. Unfortunately, when somebody uses fentanyl, the purity or the concentration isn't known to them. There's no way to tell. And added to that is the problem that there are other drugs being combined with fentanyl, and the opposite is true. Fentanyl is being combined with other drugs that people expect to be pure and are not. And so the added co-intoxicants that may be present in the drug supply are usually unknown to the user. These drug deaths then are being actually driven by fentanyl lethality. And that's true in Maine as well as nationally. We really only started getting fentanyl drug deaths in 2013. And I'll talk about this a little bit later, but fentanyl that we're talking about here is not the fentanyl that you get as a medication. They still do give fentanyl as a medication in certain circumstances, with cancer care sometimes and with certain procedures in the hospital. It's still the same chemical, but it comes to us entirely different ways. The growth has been nearly exponential since 2013, and that's true in Maine and it's true nationally. And now, as I mentioned, it's contaminating even the stimulant drug supply. And so people who are taking cocaine or methamphetamine are finding that there is fentanyl included. So the rise and the fall of these Maine drug death numbers actually is mirroring national trends, because it is actually related to the same phenomenon, and that is international drug trafficking. This is a graph that shows the fentanyl death numbers from 2013 to the present. And that is the red, the blue line, and then compared to the line of all drugs, and that's the red line. So the total that we expect this year is somewhere around 630, 636. And the number of fentanyl deaths that we expect is around 490. And you can see those curves look alike. And they also have an interesting little dip there in 2018. It peaked in 2017, dropped down in 2018, and rose again in 2019, and has continued to rise after that. This is a picture of the national drug deaths. It's not just fentanyl, but all drug deaths. And again, I want you to notice that there's a peak in 2017, a dip in 2018, and a rise in 2019. And this is found in a lot of states experiencing the same kind of distribution change. It's because it's international drug trafficking that is at the bottom of it, affecting multiple states. There's a slightly different view, and that is the percentage of increase over the previous year. And so the point here is that that percent has been increasing. So each year that goes by, we have a greater proportion of the deaths that are due to fentanyl. Over here on the right, you can see the 77% that we are estimating for 2021. And this is the US, and you can see fentanyl in this darker green line right here. And the federal data didn't divide up the pharmaceutical fentanyl very well from the non-pharmaceutical fentanyl. We were able to do that in Maine, but the coding system at the CDC, federal CDC, didn't do that very well. So, but you can still see the same thing that happened. Here's 2013, and then this exponential growth of fentanyl. They're just calling it synthetic opioids other than methadone, but it's fentanyl. Fentanyl is entirely synthetic. It is manufactured. It's an opioid in its effect, but it's manufactured. And it is being manufactured in China and shipped to Mexico to the drug cartels. It comes up to the United States from there. And the thing about it is that it's much easier to manufacture fentanyl powder than it is to grow heroin. Growing heroin is a very resource intensive and takes a long time. You can make fentanyl quickly and you only need to ship smaller amounts for the same effect on the other end, because the smaller amounts are all that's needed for the same effect in opioid terms. So my point here, maybe I'm harping on it too much, but it's very important that the fentanyl supply is rising and falling due to international patterns. And that for that reason, the overdose deaths are probably not the best outcome measure of success or failure of state programs. We have other things we can look at. Right now, the overdose toxicology reports are showing us that almost half of the fentanyl has cocaine or methamphetamine in it. 16% has pharmaceutical opioids in it. That is to say, pain drugs like oxycodone. These, however, are not prescribed drugs. These are street trafficked drugs. We are now seeing that's new in 2021, 10% mixed with xylazine, which is a kind of sedative. And here's just this is a graph, and my point with this graph is to show you that the mix with heroin, fentanyl and heroin, that was an early strategy to get people onto fentanyl. The heroin was already in the drug supply, and so the traffickers mixed fentanyl with it. That has gone down, as you can see, and cocaine took its place. And that has continued to increase. In the last couple, 3 years, they started putting methamphetamine in it. And as Gordon mentioned, this is not the one-pot method methamphetamine that we were experiencing in Maine earlier, but it is manufactured out of the country and in larger quantities. We are adding to that the stress of the pandemic. And with that, and we've talked to people out in the field who have clients and patients that are experiencing substance use disorder, and we are hearing about the increased psychological stressors, stress tolerance reduction. Of course, there's treatment access reduction. The change to telehealth and telemedicine is welcome, but in fact, the treatment workforce is reduced in Maine, and marginalized populations often don't have access to phones and computers. We have about 8 to 10% of the overdose deaths who are either homeless or experiencing housing instability. So homelessness and housing instability is a big factor with the overdose deaths. Isolation also reduces the opportunity for bystanders to save a life with naloxone. If the person themselves has naloxone, that doesn't help. You have to have somebody with you who's got the naloxone and can administer it. And with the drug supply changes, because the traffickers are experiencing the pandemic too, people are tending to make more risky choices and taking more risky substances that they don't know where they came from. They may not be aware of all the contamination. The public safety workforce is also reduced, and this has been a problem statewide. So what are we doing about it? And Narcan is really a very, very important thing that we need to be doing. But the distribution has to be to people who will be bystanders. That's the important thing. The supply of naloxone in community needs to continue to go up. It's increased by quite a bit just this year. We distributed over 77,000 doses just in the first 11 months of this year. And those doses have gone all over the state. We mapped that work, and you can see that on the mainedrugdata.org website. Getting people into treatment, of course, and just one example of the state's efforts there is the options program and the liaisons who respond to people who have experienced overdose and try to offer services of referral to treatment or recovery to those folks. They are also distributing naloxone and distributed almost 1,000 doses just as they've been getting started. And I'm almost finished here, but the deaths represent 7% of our overdose population. We are saving 93%. And this is a chart of those, how that breaks down. We deduplicate them. I want to mention the law enforcement response to over 300 overdoses that they provided naloxone for. This chart only shows the ones in which there was no EMS present. So the point is that the rising overdose deaths are being driven by fentanyl lethality and international drug trafficking, and that we really have countered with very strong naloxone distribution, emergency response, and are saving lives about 93% of the time. That's all I've got. Thank you for your attention.
Thank you, Dr. Sorg. My name is Bruce Noddin, and I'm a person in recovery, long-term recovery. I am sorry to correct Gordon. I have not been incarcerated, but a lot of folks think I have, because that's really kind of the folks that I hang out with, people who are incarcerated. I just kind of want to quickly comment on the goals set forth and the numbers that have been set out. For lack of a better word, the numbers are sobering, but there are a lot of positive numbers that we've looked at here. And, you know, it kind of reflects what we see on the ground and also kind of in the recovery community, a lot of the same goals. And as we kind of quickly move forward, I want to make sure that I honor everybody's time here as we move forward with the slides here, that you kind of come to understand that we're all kind of working together. And I'm hoping folks can see what I'm seeing.
Yes.
Thank you, Josh. So I'm going to move pretty rapidly through here, so we make sure we get out of here around 12:30. And I think if everybody remembers, Gordon said that all questions will be answered following the presentation if we didn't have time to answer them during. So I just want to talk about how Maine has established a collaborative culture of recovery statewide. And this is kind of a shameless thing. You know, 7.5 years ago, when I had a conversation with my wife about whether I wanted to die this way using substances, I could never have imagined being here today. And I'm so thankful to be able to be in the same room with Dr. Sorg and with Gordon Smith. But this is my family. This is my stepdaughter and my granddaughter, who's about 3 years old at that time, and my wife. And these are the things that I get to enjoy that I couldn't enjoy when I was using. So I want to talk about the intangibles. We've heard about the numbers. You know, I think a lot of us have a pretty firm grasp on the numbers. The other thing is I really appreciate what's been going back and forth in the chat. Those are the kind of conversations that I think are being encouraged through what's happened from the top down. You know, the first piece here is saying there's a clear message from the state for support for community-based recovery programs and solutions. And the reason why I put a little praise goes a long way is that, you know, I've been to a number of meetings around the state of Maine where Gordon is present at the meeting. And he's praising folks for the hard work that they're doing and the creative ideas that they have around recovery. And we're building a culture of cooperative, compassionate, collaborative recovery from the top down and the ground up, and we're kind of all meeting in the middle. And I kind of already touched on it that this is we're being encouraged and actively supporting creative solutions in recovery, treatment, reducing stigma, and most importantly, harm reduction. And that's been touched upon quite a bit here. We've received leadership from the governor, from Gordon, Office of Behavioral Health, Portland Recovery Community Center, Healthy Acadia, MAR, Maine Association of Recovery Residences, MERAP, with Courtney Allen, and Eastern Maine Development Corps, Workforce Solutions, Journey Magazine, community leaders, legislators, and so many more. And also, and I'm saying this is kind of coming from the top down, but it also, again, is coming from the bottom up. We're fostering these relationships between disparate organizations and groups. So the Department of Corrections and Sheriffs, district attorneys, peer recovery centers, which I'm at right now. I'm at the Augusta Recovery Reentry Center, the Office of Behavioral Health, Mental Health, Department of Labor, family members, elected officials, businesses, and folks in recovery. And promoting that involvement in leadership. So folks with lived experience. I think this is a really neat example right here at the Augusta Recovery Reentry Center, where two folks who have been incarcerated are people in recovery, are the folks that are the directors of this center. And the center itself was the brainchild of Courtney Allen, a person in long-term recovery herself. And then a whole bunch of people that have lived experience that are recovery coaches at this moment, certified intentional peer supports, as we said, managing recovery centers and recovery residences, becoming LADCs and CADCs. These are just photos from and I want to say just, but these are photos from different community meetings that we've had around the state, MPRN, Maine Prisoner Re-entry Network. So Somerset County in the upper left, on the upper right in Bangor, and then Lewiston at Bates College, and then on the lower right in Westbrook. And there's Ron Springle expressing his opinion or whatever he's trying to tell us at the transformation project. And so that's kind of that's the kind of stuff that we see in communities, but we also see on a statewide basis. This is a lived experience photo. These are all people that are at a training to become reentry peer supports, and 19 out of the 35 people that were there to get trained were folks who have been incarcerated. So that's why they're raising their hands. Another meeting here that was in Westbrook as well, at the Westbrook Library. Connection. I don't have a whole lot of time, but I'd love to tell the story of this young man over on the right-hand side sometime. Glenn Simpson with the Puzzle Project did an amazing job getting us all together. But I want to very quickly kind of talk what's going on in the state, and I really think folks need to get the credit for that. So there are these amazing meetings like those photos that you saw that are going on every month, like the CCC SUP meeting in Cumberland County that's run by District Attorney Jonathan Sarback. SCS UTF recovery meeting that's run by Rob Rogers with Kennebec Behavioral Health. The Knox County Community Collaborative, Robin Goff with Volunteers of America. Excuse me, that's in Waldo County, but in Knox County, it's run by Sheriff Carroll. Downey Substance Treatment Network in Hancock, and Substance Use SURC in Washington County, Healthy Acadia. Ormari in Oxford County, Kari Taylor. Katahdin Response Network, Recovery Augusta, MPRN statewide convening, which everybody here is invited to, and which Gordon elaborated to early on. We feel like it's a living, breathing resource guide. Numerous other community meetings that are planned in Franklin County, Androscoggin, and Kennebec. And I just want to give some quick examples of that collaboration. The Kennebec County Peer Support Pilot, which is Maine Prisoner Re-entry Network, Maine Pretrial Services, Kennebec County DA, Sheriff, Maine General, Healthy Acadia, and the Link Center, all coming together to support people getting out of jail, and in recovery and treatment courts. The Augusta Recovery Reentry Center, where I'm sitting right now, MRAP, MPRN, and YPR Augusta came together to create this space. And I want to talk about MPRN's community-based reentry Second Chance Act Award that we just got, which is a $750,000 grant over 3 years that is a collaboration between us and the Maine Department of Corrections. These and other collaborations are the vehicles for accomplishing the goals set forth by Gordon and his team for 2022. We're all in this together, and thank you for your time.
Thank you very much, Bruce. Just trying to get back live here. It's 12:29. I just want to make some final comments. Number one, I want to thank Bruce and Dr. Sorg. We are all accessible to those of you who didn't get to interact with us with a question. I've tried to answer most of the questions. I'll respond to a couple things in the chat room, and then we'll get you out of here relatively on time. There's, of course, a lot of chat about safe consumption sites, safe injection sites, and whether we're monitoring what's going on in New York City. And of course we are. We also went to Montreal and visited the sites there in 2019 and stay in touch with those individuals. But they're not considered to be lawful in Maine at this point in time. But we are looking, we will not, fail to examine every possible way to keep people safe. I do think that it's more likely that what happened in New York City is how these things might happen across the country that you notice that wasn't an act of the New York legislature. It wasn't an act of the governor of the state of New York. It was a municipal, a city, and a nonprofit type approach. And that's likely to be the case in the state of Maine, and that's just a personal opinion. There've been a lot of great comments and questions. Again, we'll answer all of them that we didn't get to today, but I did want to at least put that item. I want you to know right where we are. We're very transparent in our work. So I think with that, again, we had great attendance today. We had over 300 people. We got a big year ahead. I know we have many great partners on this call, and we're all in this together. We all really care about the work. And I'm sure as we are able to get out and about as we get through this winter, that we'll be seeing many of you live, and if not, we'll be seeing many of you on Zoom. And I'm so appreciative of all the efforts that you all put in. Don't ever hesitate to get in touch with me at gordon.smith@maine.gov. And I am try to be responsive as I can. So with that, it's 12:32. Josh and I have to get to a 12:30 Zoom. And I really appreciate your time this morning. Hope to see many of you on February 4th. Thanks again, Bruce and Marcy. Have a great day.